Welcome. It's time for health, and like they say, health is wealth. On today's segment for health, Dr. Omolabake Okunubi, a physician with over 16 years medical experience, is here to tell us about things to do to reduce the risk of having asthma attacks. She's an asthma advocate with a postgraduate qualification in public health, health management, with good understanding of the Nigerian healthcare space. She is passionate about reducing the morbidity rate and also mortality of asthma in Nigeria and Africa. You are welcome, Dr. Omolabake.
Thank you very much.
I was telling you how the name Labake is a very traumatic name for me because my first girlfriend to be was actually a Labake. However, she left me and then dated my best friend.
Oh, wow.
So, yeah, I don't like the name.
Don't do that, actually.
It gives me asthma attacks.
That was a bad Labake, I'm sorry.
But good to have you here. It's always a delight to have you.
It's a pleasure to be here again.
Let's talk about asthma. Last week we talked about asthma as it relates to people who live with sufferers and how they can help. This week we're talking in respects to sufferers themselves and how they can limit the occurrence of an attack. So what do asthma sufferers need to know when it comes to this topic?
All right, thank you very much. Like you said, we had a lot to discuss about this, or basically what asthma really is. And so I would divide, prevention of asthma exacerbation into three. I think the first thing, is we talked about education. Asthma sufferers really understanding what the disease entity is, understanding that this disease has moved from just coping with it. Now they can control their symptoms. And by control, I mean that they can actually be asthmatics without asthma. That means they can, the processes that have been put in place in terms of therapy, medications that, allow them or that prevent them from having their symptoms. So that's one part. Now, the second part is avoidance of triggers. So they need to be educated enough to identify, their triggers, whether, their family helping them, their doctors helping them to identify what their triggers are. Because, of course, with asthma, we've talked about the fact that asthma exposure to triggers would also, cause attacks, like we popularly call it. Now, the third part, which is the most important part, which I'm talking about, this control, and of course, the whole world in terms of management of asthma has moved to controller. It's no more you have attacks, you come to the hospital, they revive you, and you go back home. No, post going back home, there's now things you can do. There are medications you can take on a daily basis that would help you prevent your exacerbation. Now, what these medications do, I related the tube, the bronchi, to like the tube last week, where we talked about the straw. And so the bronchi, the controller medication sort of help the tube to maintain some form of stability, preventing them from having that kinking that we talked about, from having that inflammation that we talked about as a swelling that occurs in the tube. And so sort of helping the bronchi airway of an asthma patient begin to mimic that of a normal patient without asthma.
Is this a lifelong drug that they have to continue taking, or is it a cure?
So basically, you wouldn't say there's a cure for asthma, but it can actually be managed. So it means that, sadly, because asthma is a chronic disease. When we say chronic disease, it's like, when you relate it to other kinds of medications like hypertension, diabetes, those are medications that basically once you start having them, your medications are almost like lifelong. I mean, we don't like to hear that, but that's a fact about it. And so that's the same thing with asthma. Because asthma is a chronic disease, so it's not something that, you have and then it goes away like malaria or like headache and all of that. It's something that, keeps going on. And the sad part is that once patients start getting better, a lot of them tend to want to discontinue this controller medication. So that's where the education and counseling always comes in, that the moment you discontinue, then you go back to having your symptoms again.
Right. So I have a special question here from one of our producers, and he's asked me to ask you this specifically. Now, he's asked that for people who have never been diagnosed of asthma before, above 40, you go to the hospital and then you're diagnosed with asthma. How is that possible? Has it always been there, or is it just a new thing?
Yes, so most times you find out that this class of people have what you call the phenotype. That means it's a medical term, like the phenotype.
Okay, yeah, I get
you. So they most likely would have had it even as children. Okay, it probably was missed. The diagnosis was missed as a child, or maybe, of course, way back, it was a bit more difficult diagnosing asthma in children. It's a lot better now. I mean, a lot of parameters have been put in place to make it a lot easier for doctors to be able to make the diagnosis. But way back, a lot of people would, you know, and because asthma in children, it's not very classical because, you know, we say that sometimes it's not all that we say is asthma in children. Children may just have respiratory tract infection and they may have symptoms that are similar to asthma. So it's neither here nor there, particularly children under the age of 2. So it's not very 100% clear to say, look, I can make it an appropriate diagnosis in asthma in children. Yes, pediatric pulmonologists are able to do that properly, and like I said, there's some criteria that have been put in place. So most times you find out that this class of people that you're talking about that develop asthma in later years usually would have had some form of, you know, symptoms as children, or they had it. Yeah, they never noted it. They was never diagnosed or whatever. And then in later life, you know, you know, sometimes people will say, oh, they outgrow the asthma.
Yeah, so that's really, what was coming. Yes. Is it possible to outgrow it?
So it's really not outgrow as it were. It's just that, you know, there's something called clinical remission where asthma patients would go on for a period of time without their symptoms. For some reasons, you know, they could have that. And then, like we've talked about, stress in later years, either exposure to either emotional, for instance, emotional stress and all of those things, psychological can actually then cause the triggers to come back. I mean, like, I usually would make jokes like sometimes maybe someone just gets married, you know, and then the stress of marriage, and you're like, oh my God, or moves to Lagos, the stress of Lagos, and then, you know, you realize that, you know, you can't then have.
So that brings me to my next question now. So we've spoken about triggers, especially since last week and even here today. Now, triggers that you have mentioned could be related to perhaps maybe dust or this or that.
It could have dust mites, it could be outdoor pollution, so indoor pollution.
These are all related to you taking in air in some way or the other. Are there other triggers that are not related to the airway? For instance, you mentioned stress. Could stress also be a trigger for asthma patients?
Yeah, absolutely. So you have emotional triggers. So it could be from maybe heartbreak. It could be from stress.
Oh, wow.
Yes.
Wow. All y'all heartbreakers out there, do be careful now.
Absolutely. You know, anything that sort of causes some form of emotional stress can actually be a trigger for asthma patient.
Wow, that's a new one. So for these people who have lived most of their lives without even knowing that they have asthma, or some people who actually think that they've outgrown it, do they still need to continue with drugs because they've been around for so long without it?
So when they were not having it, of course, there wasn't need for medication. But the moment they start having their symptoms again, the essence is that we don't want them having symptoms because the symptoms can actually kill them. And you can't tell.
So if they're not having symptoms, they don't need the drugs?
Yes, so they're not having symptoms. They've gone into the clinical remission where they were not for so long, they weren't having symptoms again. You know, not because they were taking medication. Okay, it's a different thing where you're not having symptoms because you're on medication or you're controller. Because the truth about it is that if you're having symptoms, the diagnosis has been made, you start the controller medications to prevent you from having your symptoms. Okay. So that's a different thing. I'm talking about people that have, like you've just explained, that didn't have symptoms for so many years and suddenly at 40 started having symptoms. So if you start having symptoms at 40, then you should start, you know, you should see your doctor and talk about controller to your doctor. I mean, if there's any asthma patient out there that is not on controller medication, then you need to speak to your doctor to say, look, how do I need some controller medications.
Are you more at risk in older years now, like for that one person who's just realized that I am an asthma patient? Are you more at risk now?
So I wouldn't say are you more at risk now, because the truth about it is that the fact that whatever age you have the symptoms, whether as a child, whether as in mid-age, whether as an old age, is the same. The risk is the same because your asthma symptoms can actually kill you. So you don't, I can't say, oh, look, Mr. A, if you have asthma today, this one would not kill you. It's the one that would happen tomorrow that would kill. You know what I mean? So basically, but we don't want them having the symptoms because the symptoms, you know, can go from mild to moderate to very severe and to really being fatal. Okay. So that's the essence.
Well, Dr. Omolabake, or no, Dr. LBK, I'd rather that.
Yes.
It's grand always having you here to help us note how we can manage these asthma issues, especially for sufferers and also for people living with people who are suffering as well. It's always a pleasure. Looking forward to seeing you again here next week. And we'll be talking about something else, but based on the same theme.
Absolutely.
Thank you very much. We've got more coming away. I can hear the sizzling and smell the beautiful fragrances from inside of the kitchen. Who do we have in there?